Bismillahirrahmanirrahim. Today I'll be presenting a critical appraisal of a study, which is a cross-sectional study. I am Dr. Amna Khan. I'll be presenting this critical appraisal under kind supervision of the most worthy, the most kind professor, Dr. Saira Afzal. Let's start with the quote of the day. If Allah can turn night into day, then surely Allah can turn the darkness of your life into happiness and prosperity. Trust in Allah. I'll be using a strobe checklist for the critical appraisal of this cross-section study, and final criteria for my title. The title of the study is A Cross-Sectional Study on Prevalence and Associated Risk Factors of Scabies in School Children of Pakistan. Abstract. Scabies is an endemic and contagious skin disease caused by Sarcoptes scabies. In many tropical countries, including Pakistan, it is estimated that more than 175 million people were infested with scabies throughout the world. It can have a significant impact on general health, causing illness and death not only as a direct result of its infestation, but also as a result of secondary bacterial infection. A cross-sectional survey was conducted from August 2021 to December 2021 in private and government schools of KPK, Pakistan. The overall prevalence of scabies was 26.3%. Middle-class male children were highly infested with scabies, then primary and metric class female children. Overall, maximum prevalence was recorded on males than females. Children from villages, 44.01%, were more likely to have scabies than those having in cities, 26.85%. Lesions were usually distributed on more than one body region, and most infested body part was finger. Scabies prevalence was higher among 9 to 12-year-old compared to 5 to 8 and 13 to 16 years old. The respondents, the statistically significant difference between the presence of scabies and some socio-demographic characteristics, area of residence, age, and sex is P is equal to 0.01, P is equal to 0.06, and P is equal to 0.013 respectively. The respondents which frequently wash their clothes and body found less affected by scabies than those who do not care about their health and cleanliness. This is a significant scabies burden which we believe justifies healthcare intervention. Introduction. Here, the scientific background is mentioned. The human scabies is a skin parasitic disease caused by the infestation of a mite. Sarcoptes scabies, it can burrow under the various tissues and organs of the tissue body, especially in the skin. All age of people is infested by the scabies throughout the world. Approximately 46 to 65% prevalence of scabies has been reported throughout the globe, especially in African countries. Many surveys on the prevalence of scabies have been conducted in several areas of limited number of countries such as Turkey, Africa, and Fiji. No cross-sectional study on the prevalence and associated risk factors of scabies has generally been conducted in Pakistan, particularly in current study area. There is limited study done on scabies in school children, so insufficient data and pieces of information regarding scabies are available to adopt control measures and control strategies. Taking into account the highly endemic status of scabies and impetigo in KPK, Pakistan, we conducted a cross-sectional study to provide comprehensive information. Materials and methods, study area and duration. A cross-sectional study was conducted in rural and urban area schools of KPK, Pakistan, to find out the prevalence and associated risk factors of scabies from August 2021 to December 2022. Sample size, participants. The research team visited 10 government schools and 10 private schools in rural and urban areas. A total of 550 students, out of which 250 were from the government and 310 students from private schools participated in the survey. The age of participant was in between 5 to 16 years. Data collection was done by dermatologists using the face-to-face interview technique. Ethical approval permission. Ethical approval was obtained. Statistical analysis. Collected data were put on Microsoft Excel sheet, and the chi-square test was used in the binary analysis. The variable that were statistically significant, P less than 0.05 in the chi-square test, were taken into backward logistic regression analysis. Results and discussion. Age-wise data showed the males were highly 41.07% infected by scabies and females, 32.80%, 80%. The significant difference was recorded infection of scabies in both sexes. The statistical significance difference between the presence of scabies and some socio-demographic characteristics, area of residence, age, and sex. There were no statistical significance difference was recorded between scabies, the number of households, and the family type. P is equal to 0.6 and P is equal to 0.4 respectively. Children in between the age of 9 to 12 years were recorded highly infested with the disease, followed by 13 to 16 years and 5 to 8 years. Here you can see some of the tables are given in this section of results and discussion. So the demographic characteristics of the participants are mentioned here in this table. Here are some of the demographic characteristics. The dispersion of the characteristics over scabies in the study area are mentioned in this table. The dependent variables and the outcome variables are the dependent and the independent variables. So the demographic characteristics include the categorical variables, which are sex, age, family type, area of residence, number of family members, number of rooms, education level, school type. So they have done the subgrouping of age as well, that is 5 to 8. And then the prevalence is mentioned, prevalence of scabies is mentioned accordingly. Sex-wise prevalence of scabies is mentioned here. Prevalence percentage of scabies on different body parts and the hygiene characteristics of the school children in the study area, which depends upon the body washing, clothes washing, cloth changing, which are the variables being mentioned here. And the environmental factors of the participants associated with the scabies: bed share, light, pet house, water source. The overall prevalence of scabies in school children was 26.3%, which is almost similar to the previous studies. Reported 30.60 prevalence of scabies. So basically in this paragraph, they have mentioned the prevalence, and they have compared it with the different previous studies that have been done previously. Now let's start with the critical appraisal using the strobe checklist. For the title and abstract, it indicates the study design with a commonly used term in the title or the abstract. Title is concise and clear. It does mention the study design. Abstract does mention the study design. B, provide in the abstract an informative and balanced summary of what was done and what was found. Abstract is informative, but it does not provide a balanced summary of what was done and what was found. It lacks a clear objective. It is unstructured. Background, a rationale, and the introduction. The background and the rationale. Explain the scientific background and rationale for the investigation being reported. Yes, the scientific background is explained and the rationale for the investigation is being reported, but the rationale is weak, as they have the base or the criteria for the rationale they have chosen is the geographical distribution and the age, which is relatively a weak criteria for the rationale. Objective, state specific objectives including any pre-specified hypothesis, not mentioned. Methods, study design presents key elements of study design early in the paper. Yes, mentioned. A cross-sectional study was conducted in rural and urban schools of KPK, Pakistan, to find out the prevalence and associated factors of scabies from August 2021 to December 2022. Setting, describe the setting, location, relevant dates, including periods of recruitment, exposure, follow-up, and data collection. Yes, mentioned. Research team visited 10 government schools and 10 private schools in rural and urban areas. And from August 2021 to December 2022, data collection was done by the dermatologist using the face-to-face technique. Methods, participants gives the eligibility criteria and the sources and methods of selection of participants. It does not give the eligibility criteria, including and excluding criteria are not addressed clearly. It does not mention the sources and methods of selection of participants. Variables. In the methods section, variables clearly define all the outcomes, exposures, predictors, potential confounders, and effect modifiers, give diagnostic criteria if applicable. Yes, they mentioned the outcome variables, which are the dependent and the independent variables. Categorical variables are addressed. Social demographic characteristics include age, sex type, sex, family type, area of residence, education level, and school type. Hygiene characteristics: body washing, clothes changing. Environmental factors include bed share, pet, light, house, water source. Data sources and measurement. For each variable of interest, give sources of data and details of methods of assessment, not clearly mentioned. Bias, describe any efforts to address potential source of bias, not mentioned. Study size, explain how the study size was arrived at, not mentioned. Quantitative variables, explain how quantitative variables were handled in the analysis. If applicable, describe which group were chosen and why. It is not mentioned, not applicable here. Methods, statistical methods, describe all statistical methods, including those used to control for confounding. Yes, mentioned chi-square test was used in the binary analysis. The variables that were logistically significant, p less than 0.05 in the chi-square test, was taken into backward logistic regression analysis. They have done the stratification to control the confounding effect of age. And they have justified the chi-square as they have chosen the categorical variables. Describe any methods used to examine subgroups and interactions. Not mentioned, missing data were addressed. No, they have not mentioned it. They have not addressed the missing data. Results. Participants report number of individuals at each state of study. For example, numbers potentially eligible, examined for eligibility, confirmed eligible, included in the study, completing follow-up and analyzed. Not mentioned, give reasons for non-participation at each stage. Not mentioned. Consider the use of a flow diagram. No, they have not considered it. Outcome data, report numbers of outcome events or summary measures. Yes, mentioned. Results. Give unadjusted estimates and, if applicable, confounder adjusted estimates and their precision. For example, 95% confidence interval. Report category boundaries when continuous variables were categorized. Not mentioned here. If relevant, consider translating estimates of relative risk into absolute risk for a meaningful time period. Not applicable as they have considered the prevalence, and for the risks you need to have the incidence. So it's not applicable here. Other analysis. Report other analysis done, for example, analysis of subgroups and interactions and sensitivity analysis. No, they have not mentioned. Discussion. Key results, summarize the key results with reference to study objectives. Yes, it does summarize the key results. Limitations. Discuss limitations of the study taking into account sources of potential bias or imprecision. Discuss both directions and magnitude of any potential bias. They have not mentioned here. Interpretation. Give a cautious overall interpretation of results considering objectives, limitations, multiplicity of analysis, results for similar studies, and the relevant evidence and other relevant evidence. Yes, it's mentioned. Discussion. Generalizability. Discuss the generalizability, external validity of the study results. Not applicable. It's a simple observational cross-section study. Other information. Funding. Give the source of funding and the role of funders for the present study, and if applicable for the original study on which the present article is based. Not mentioned. Ethical considerations are done, and informed and written consents are taken. Summarization of key points of critical appraisal. The strengths. Title is concise and clear. Scientific background is mentioned. Setting mentioned. Stratification is done to control the confounding effect of age. Statistical analysis interpretation is well. Chi-square is justified. P-value is given, which is P is less than 0.05. Though if they have done the causation, it would have improved their statistical analysis. Explain the outcome variables, the categorical variables. Consent is taken. Ethical approval taken. Limitations. Abstract is not balanced and has no clear objective mentioned here. Rational is weak, as I've previously told that they have made the base of the rational as a geographical distribution and the age groups, which is relatively a weak criteria. Missing data is not addressed. Generalizability, externality of the study results not considered clearly. Limitation not mentioned. Bias, for example, the recall bias, selection bias, and interviewer bias not addressed. Limitations, including and excluding criteria not defined properly. Sampling technique not mentioned. Sampling size calculated not considered. No flow diagrams. Source of funding not mentioned. Source of collection, data collection not well defined. Thank you so much, everyone, for listening. Here is the link of my YouTube channel, of our YouTube channel. Kindly please like and subscribe. Thank you so much.
Assalamu alaikum. Thank you so much, Dr. Ambar. Yes, please go ahead with the criticism. Okay, ma'am. Dr. Amna, it was very nicely presented as we selected the cross-sectional study. So there were two reasons why I selected this article. First of all,